Acute pancreatitis station.
A 45-year-old male diagnosed and managed for acute pancreatitis 2 weeks ago, who now presents with tachycardia, tachypnea, and shortness of breath. What could be the possible diagnoses?
Possible diagnoses could include pancreatic pseudocysts or abscesses, pulmonary embolism, acute respiratory distress syndrome, ARDS, sepsis, congestive heart failure exacerbation, or pleural effusion.
Why could a patient with acute pancreatitis be tachypneic?
Tachypnea or rapid breathing in a patient with acute pancreatitis could be related to pain, anxiety, systemic inflammatory response, metabolic acidosis, or hypoxia resulting from lung involvement, example pleural effusion, ARDS.
What scoring systems are used for assessing severity and prognosis in acute pancreatitis?
The Ranson's criteria, Apache 2 score, and BISAP score are commonly used scoring systems for assessing severity and prognosis in acute pancreatitis.
Is serum amylase included in scoring systems for pancreatitis?
No, serum amylase is not included in the above-mentioned scoring systems for pancreatitis. These systems rely more on other laboratory values, patient demographics, and clinical manifestations.
Why could amylase levels be normal in pancreatitis?
Amylase levels can return to normal after 3 to 7 days even in ongoing pancreatitis. It can also be normal if the cause is hypertriglyceridemia or if there is significant pancreatic necrosis.
Besides amylase and lipase, which other enzymes could be checked in pancreatitis?
Other than amylase and lipase, serum trypsinogen and elastase can also be checked.
Can you explain the pathophysiology of hypocalcemia in pancreatitis?
In pancreatitis, saponification can occur where free fatty acids from fat necrosis combine with calcium to form soap, leading to hypocalcemia. Also, systemic inflammation can lead to hypoalbuminemia, which can lower total serum calcium levels.
What is the pathophysiology of hyperglycemia in pancreatitis?
Hyperglycemia can occur due to insulin resistance and impaired insulin secretion due to pancreatic inflammation.
How should nutrition be managed in a patient with pancreatitis?
Initially, fasting is recommended to rest the pancreas. Later, a low-fat, high-protein diet is preferred. If oral intake is not possible, enteral nutrition via a feeding tube is preferred over parenteral nutrition.
What are some complications of pancreatitis?
Complications of pancreatitis can include pseudocyst formation, pancreatic necrosis, ARDS, pleural effusions, splenic vein thrombosis, and multi-organ failure.
How is splenic vein thrombosis treated?
Anticoagulation is usually the first-line treatment for splenic vein thrombosis. In cases of gastric variceal bleeding, endoscopic banding, TIPS, transjugular intrahepatic portosystemic shunt, or splenectomy may be considered.
What are the functions of the pancreas?
The pancreas has two main functions: exocrine, producing digestive enzymes, and endocrine, producing insulin and glucagon.
What are the causes of acute pancreatitis?
Gallstones and alcohol are the most common causes of acute pancreatitis. Other causes include hypertriglyceridemia, certain medications, and trauma.
Can you explain the pathogenesis of acute pancreatitis?
The pathogenesis of acute pancreatitis involves the premature activation of pancreatic enzymes, which leads to autodigestion and inflammation of the pancreas.
Identify different organs in a CT scan.
Liver, spleen, pancreas, aorta, vertebrae, and stomach identified.
How would you identify a massive pseudocyst in a CT scan?
On a CT scan, a pseudocyst appears as a round or oval fluid-filled structure with a well-defined inflammatory wall.
What are common CT findings in acute pancreatitis?
CT findings in acute pancreatitis may include enlargement of the pancreas, peripancreatic fat stranding, fluid collections, and in severe cases, necrosis of the pancreas.
How is acute pancreatitis managed?
Acute pancreatitis is managed with fluid resuscitation, pain management, nutritional support, and treating the underlying cause. In severe cases, ICU admission may be required.
What is the role of corticosteroids in pancreatitis?
Corticosteroids are not typically used in the treatment of acute pancreatitis. They have been studied in autoimmune pancreatitis but not in other types of pancreatitis.
Are antibiotics routinely used in acute pancreatitis?
No, the routine use of antibiotics is not recommended in acute pancreatitis unless there is evidence of infected necrosis or another source of infection.
How is pain managed in pancreatitis?
Pain in pancreatitis is usually managed with intravenous opioids. NSAIDs and other analgesics can also be used.
What is a pseudocyst?
A pseudocyst is a collection of fluid rich in pancreatic enzymes, blood, and necrotic tissue, typically surrounded by a wall of fibrous or granulation tissue.
Where do pancreatic pseudocysts usually develop?
Pseudocysts usually develop in the lesser sac of the abdomen, posterior to the stomach, but they can form anywhere in the abdomen.
What are the symptoms or presentations of a pancreatic pseudocyst?
Patients with a pancreatic pseudocyst may present with abdominal pain, nausea, vomiting, weight loss, or a palpable abdominal mass. Some pseudocysts are asymptomatic and discovered incidentally on imaging.
What are the complications of a pancreatic pseudocyst?
Complications of a pancreatic pseudocyst can include rupture, infection, hemorrhage, obstruction of the stomach or bile duct, and development into a pancreatic abscess.
What is the difference between a true pancreatic cyst and a pseudocyst?
True cysts are lined by epithelium, while pseudocysts are lined by fibrous or granulation tissue. True cysts may be congenital or neoplastic, while pseudocysts typically arise following pancreatitis or trauma.
How is a pseudocyst managed?
Options for managing a pseudocyst include observation for asymptomatic, small pseudocysts, endoscopic drainage, or surgical drainage for larger or symptomatic pseudocysts.
How can a paracetamol overdose lead to liver injury?
Paracetamol overdose can lead to hepatotoxicity because it produces a toxic metabolite, NAPK, that depletes hepatic glutathione, leading to cell damage and death.
How is a pseudocyst diagnosed?
A pseudocyst is usually diagnosed by imaging, such as CT, MRI, or endoscopic ultrasound. Findings include a well-defined, round or oval, fluid-filled structure, typically with a fibrous wall.